EROS has actually worked, has helped, we're back onto a good sex life again.
I think it's important for women to know that there is something out there. EROS, I think, has changed a lot of women's health and well-being.
Oh, it's definitely improved my life. I'm looking forward to having sex again.
Using the EROS device really gives us a chance to take control of our bodies.
The EROS therapy improves symptoms of female sexual dysfunction, or FSD, related to blood flow, specifically arousal and orgasmic disorders. The EROS increases blood flow by applying a gentle vacuum to the clitoris and external genitalia. When used as described, the EROS therapy program can restore your natural sexual responses, resulting in increased genital sensitivity, deep vaginal lubrication, an enhanced ability to achieve orgasm, and overall increased sexual satisfaction. I'm going to tell you about the EROS and how to get started on the therapy. This will include information about assembly and use of the EROS, how to care for it, and ordering replacement accessories. You'll receive everything you need in the product box. This will include the EROS therapy device, an instruction manual. Before you begin using the EROS, be sure to read the manual in its entirety. It describes precautions and risks associated with the EROS therapy. An instructional video is also provided on the use and care of the EROS therapy device. A startup supply of 2 disposable Caress cups, 2 AAA batteries, and a satin carrying pouch. A Caress extension is included as an optional accessory, but isn't necessary for EROS therapy. You'll also find an EROS therapy reorder form for Caress cups and other accessories, and a warranty card. The first step is to assemble the EROS. To insert the 2 AAA batteries in the battery compartment, pull up on the tab with your thumb and remove the cover. Place the batteries in the compartment matching the plus and minus symbols on the EROS and each battery. Fit the top of the cover back into place. Then push down on the lower end of the cover to snap it shut. Once the batteries are in place, the next step is to attach the Caress cup to the EROS. Hold the wide end of the cup between your thumb and forefinger and push the narrow end into the hole in the indented area at the top of the device. It is very important that you feel comfortable using the EROS before you begin the therapy. To practice, try using it on the palm of your hand by following these steps. Place the Caress cup over the fleshy area by your thumb on the palm of your hand. Locate the on-off switch on the side and slide the switch toward the cup to turn the EROS on. You can adjust the amount of vacuum using the vacuum dial on the opposite side of the EROS. Rolling the dial toward the cup decreases the vacuum level. Rolling the dial away from the cup increases it. The EROS has been tested for safe levels of vacuum, even on the highest setting. Slowly increase the vacuum level while applying gentle pressure to the cup until a seal is created under the cup on your skin. Finally, release the vacuum by decreasing the vacuum level. Review the safety features section of the instruction manual for other ways of releasing the vacuum. The vacuum level can also be pulsated to mimic blood flow. To practice this, you must leave the vacuum dial on its lowest setting. Place the Caress cup on your palm and use your thumb or finger to cover the vacuum port, which will increase the vacuum. Then, uncover the port to decrease the vacuum. Repeat these 2 steps to pulse the vacuum level. You can also use the optional Caress extension for more freedom of movement and flexibility in cup placement. To attach the extension, insert the plastic adapter into the hole at the top of the EROS and the other end onto the Caress cup. When you feel comfortable practicing on the palm of your hand, you're ready to begin EROS therapy. Find a comfortable position. Then use your fingers to open the outer folds of your genitalia. Place the caress cup above the vagina over your clitoris. The cup should be on the skin surface, not inserted into the vagina. Turn on the EROS with the vacuum level at its lowest setting. Apply gentle pressure to the cup and adjust the vacuum dial to obtain a seal around your clitoris. Start your therapy program by using the EROS on low vacuum for 60 seconds. If you become uncomfortable before 60 seconds, release the vacuum and note the time interval. Now remove the EROS for 60 seconds. Using, then removing the EROS is called a therapy cycle. Repeat this therapy cycle 3 to 5 times. If you are using the EROS for less than 60 seconds, gradually increase the time to 60-second intervals. It is recommended that the EROS therapy is repeated a minimum of once a day, 4 days a week. The EROS should also be used prior to intercourse to improve clitoral and genital sensation, vaginal lubrication, orgasm, and overall sexual satisfaction. Wait at least 1 hour to use the EROS after you've completed 5 therapy cycles or after intercourse. The next step in your therapy program is to gradually increase the vacuum time interval from 60 seconds up to 3 minutes, leaving the EROS on low vacuum. Continue to use therapy cycles of using, then removing the EROS for equal time intervals. Repeat this 3 to 5 times. Once you're able to extend your cycle to 3 minutes without discomfort, the last steps of your therapy program are to increase the vacuum levels to moderate and then high. It is important to remember that an immediate change in symptoms may not occur. The EROS therapy diary in the instruction manual is provided to help you track the therapeutic use of the EROS. This information will be useful when discussing the EROS therapy with your doctor or nurse. With regular use of the EROS, an improvement is typically seen within several weeks. Caring for the EROS is quick and easy. Clean the outside of the EROS with a damp cloth as needed. Do not submerge or operate the EROS in water. The caress cup and extension should be cleaned with mild soap and water. Remove them from the EROS before cleaning and let them dry completely before reattaching them. Between uses, store the EROS and caress cups in the satin carrying pouch. The caress cup should be replaced within 10 uses. More frequent cup replacement may be necessary if the filter in the cup becomes clogged from incomplete cleaning. It is not necessary to use lubricants with the EROS therapy. If lubricants are used, the cups may need to be replaced more often. You can order additional cups and other accessories by using the EROS therapy reorder form or by calling EROS Care Line toll-free at 1-877-774-1442. Please complete the warranty card. If you have further questions about the EROS therapy, contact your physician or call the customer care department.
Our life has changed dramatically again. We are back to being like we were when we were newlyweds. The EROS has helped immensely. It has gone back to being a very good thing. Life is good again.